A very good morning to everyone. We apologize for the delay in starting the session because we want more participants to join in. That's the reason we have delayed the session. Now we have a quite good amount of participants here. 31 participants has joined in. So due to some emergency work at ministry, Dr. Sridhar Reddy, who is the moderator for today's session, is unable to join the session, and I am representing on his behalf. And my name is Asha Sharma, and I am a master trainer at Senior Citizen Division of National Institute of Social Defense. So a very warm welcome to everyone. As a part of September 2021 World Alzheimer Month campaign, NIST, in association with ARDSI, is arranging an online panel discussion on dementia awareness and management to raise awareness and challenges and stigma surrounding dementia and Alzheimer patients. So, for today's session, our resource persons are Dr. Vinod Kumar. Sir is President Emeritus Alzheimer and Related Disorder Society of India. Lifetime Achievement Award in Aging Vayoshisht Samman 2011 from Ministry of Social Justice and Empowerment, Government of India. He also received Lifetime Achievement Award from Indian Aging Congress, received from India's Health Minister in the year 2004. Founder Secretary Research Society for Study of Diabetes in India, currently over 6,000 membership, national body and patron of its Delhi chapter. He is a professor of medicine and head geriatric clinic, All India Institute of Medical Sciences, New Delhi. He is also a professor and head of endocrinology department, PGI Chandigarh. He is a member of WHO Expert Advisory Panel on Aging and Health, member National Council for Older Persons, Government of India. He is also a member State Council for Senior Citizen, Government of NCT Delhi. Welcome, sir, for today's session. The another panelist we have Dr. Matthew Varghese. He is Senior Professor of Psychiatry, Consultant Adult Geriatric Family and Community Psychiatry, Bangalore. He had a former affiliation with National Institute of Mental Health and Neurosciences, NIMHANS, Bangalore. He has a current affiliation to St. John's Medical College, Bangalore. Welcome, sir, for today's session. The third panelist we have Madam Meera, who is a chairperson, Alzheimer's and Related Disorder Society of India, board member, Alzheimer Disease International, chairperson for Asia Pacific Regional Office of ADI, member, World Dementia Council. And the fourth panelist we have is Madam Nilanjana Maulik, who is the secretary at ARDSI, Calcutta. So I would like to welcome you all, ma'am, on behalf of National Institute of Social Defense, to go ahead with the session, ma'am. So am I audible to everyone? And I have also shared a link for the registration. So kindly go ahead with doing the registration for the link that I have shared in the chat box. And I would request everyone to please switch on your cameras so that everyone is visible during the discussion. And then if any participant has any question, there will be 15-20 minutes session interaction session with the panelists. So participants can unmute their mics and can ask our resource persons any question related to today's webinar session. So Matthew, sir. Matthew, sir.
Can you see me and hear me?
Yes, sir. I'm able to see you and to hear you also. Your voice is audible to us.
I can't see anybody. I can only see this this poster. Ah, there you are. Okay. Thank you.
Sir, can we go ahead with the session, sir? Matthew, sir?
Yeah, go ahead, please.
Okay, sir. Because today is our panel discussion and we have 4 panelists here. So the first question will be to you, sir. Sir, what are the ways in early diagnosis important in dementia? What is the pathway for diagnosis in dementia? And what should I tell people if I or my loved one have a diagnosis of dementia?
Yeah, so the diagnosis of dementia should be suspected for any older person, say anybody who's over the age of 60, 65 years, who has got memory problems. It's important to tell family members and people in the community that memory problems are not a part of normal aging. As you grow older, you can have memory problems, but when memory problems start to affect your daily life, then it becomes something that needs to be investigated and inquired into. So anybody who's got a memory problem and somebody is reporting a memory problem, when you go to a doctor or when you go to any other professional, or even for family members and people in the community, you must not um, brush it aside saying, oh, it's you're old, so that's why you're having memory problems. So any memory problem should be investigated. And the reason why it should be investigated and found out whether it is a disease or not is because if you intervene early, then the person with dementia can have some treatment which might prevent him from progressing very rapidly. And secondly, um, if the treatment is early, you can start some medicines which can delay the progress of the illness. The second thing is that in addition to what will benefit the patient, the family will also learn to live with the disease much earlier. So the family needs to understand that they're going to deal with a long problem, maybe going on for 5 to 10 years, and they need to learn to help this person with dementia with different activities, maybe activities of daily living, maybe behavioral problems, and so on. They also need to figure out what's going to happen when this person is not able to do many of the things that he or she cannot do. For example, the roles that the person is going to perform, or maybe issues, legal issues or property issues. These are all things that family members should really be prepared for. So that is the reason why we must do screening for people who are over the age of 55 or 60, look for memory issues, and we must definitely do screening for people who have other medical diseases. For example, diabetes mellitus, hypertension, people who have had strokes. So all what is known as non-communicable diseases must actually be screened. And now in the current times of COVID, even people who have had COVID, they can also be screened because many of them might complain of memory issues. And this might even occur at a younger age. But COVID causing cognitive problems or memory problems can occur also, an added problem that we faced in the last 1.5 years or so. So to find out if somebody has got dementia, any doctor, any general practitioner, any family physician should be able to do brief screening instruments that will help with finding out whether somebody has got uh, a diagnosable disease. That is what we need to do. The usual pathway, um, as the chairperson mentioned, the usual pathway is that the the family members or the patient usually goes to somebody who they know and say that, oh, I seem to be forgetting, I have some memory problems. And then they go and visit their usual GP or their family physician. And many times the family physician says, don't worry, you are 60 or you're 75. No, memory problems are, part of aging. Even I have some memory problems. They sort of, wish it away. And that is something that should not happen. So many times before the person with dementia presents to a geriatrician, a psychiatrist, or neurologist, they have already visited 2 or 3 physicians, they've already talked to 2 or 3 family members, and it's usually about 2 years when they come and present to the person to any medical facility which might help them with a diagnosis and treatment of dementia. So 2 years is too late in my mind. So we need to pick up people to intervene in the first year if possible. And that is what we need to do. And many times they come to the hospital to a psychiatrist or a neurologist or a geriatrician when the person has got behavioral symptoms, and that is usually in a moderate stage or late early stage. And by the time they have agitation or they have apathy or they are not able to do activities, that is when they are brought to the hospital or to the doctor, because then the problem starts, the behavioral problem starts bothering the person, the family, and everybody else who the person is in touch with.
Thank you so much, Matthew, sir. Sir, am I audible to you?
Yes, you are.
Okay, sir. Okay, sir. Thank you so much for giving this valuable information to us, sir. Another question is to Dr. Vinod Kumar. Sir, am I visible and audible to you?
Yes, you
Vinod,
are
sir?
audible. You are audible.
Okay, sir. Sir, I have a question. Like, who are the persons at risk of developing dementia? What preventive measures should one take to prevent dementia in old age? And how does the onset of dementia affect other pre-existing chronic diseases present in the old age, sir?
Well, the people who are liable to get dementia, of course, the most importantly, it is the elderly people. The
We
majority of
can't hear
patients.
you. If you can come
Can
closer to the mic, then we can.
are you able to hear? Now you see? Can you hear me? No.
Yes, sir. We are
You
able to
can.
hear you, sir.
Yes. Matthew, are you able to hear me now? So something wrong with the, I think, audio of Dr. Matthew. But Ashaji, you are able to hear me?
Yes, sir.
Okay. So I can go ahead. So, as I was telling that dementia is a commonly disease present in old age, but it doesn't mean that it cannot happen in younger age. Sometimes, not very commonly, but it can happen earlier than the age of 60 also. So, age is the most important risk factor for getting dementia. And with age, as a person advances into old age, the prevalence of dementia goes on increasing, almost doubles every 5 years. So if at the age of 60, 65, 2% of people have dementia, by the age of 90, as many as 40% of people will be suffering from dementia. So that is the first and foremost important rule, that it is the mainly the elder people who get dementia more commonly. Then there are other risk factors also. These risk factors could be medical risk factors, these could be socio-economic risk factors, and so on. And Dr. Matthew, in passing, did mention some diseases. So I would just like to say once again that people who are diabetic, people who have high blood pressure, or people who have history of stroke, or people who have other cardiovascular disease, or people who have some other chronic other non-communicable diseases, they have greater chance of getting dementia. Similarly, people who have hypercholesterolemia, their cholesterol and lipids are high, they also have more chance. Apart from these medical factors, there are certain other non-medical factors also. One of them is a lack of early education. People who remain illiterate during their early formative years, they are more liable to get dementia when they become old. People who do not sleep well for years together, this is another risk factor for getting dementia. Then people who have a hearing defect. That is one more risk factor. And very importantly, people who do not socially interact, people who remain introvert, and they do not have many friends, for example, they are liable to get dementia more often than those who are well connected with their social support and friendship. Then I think people who do not do physical activity, they are sedentary or they are overweight or obese, they also have more chance of getting dementia. So that is as far as the risk factors of dementia are concerned. But I would like to say that there are some few cases of what is called reversible or treatable dementia. What so far I have told you, the majority of them were irreversible dementia. But there are some kinds of reversible dementias also. For example, vitamin B12 deficiency, or people may have hypothyroidism, they may have salt deficiency, they may have chronic kidney, liver or lung disease, they may have history of head injury, or they may have history of brain tumor or a condition called normal pressure hydrocephalus. They can all be having dementia, and this particular dementia is reversible, and these are also much less common compared to the usual dementias which I have named earlier, which are irreversible. So this is the answer to the first question, the who are the people who are liable to get dementia. Your second question was that uh, if the patient has dementia, uh, how does it affect if he also happens to have other diseases? Now, you know, dementia is a disease where the power of reasoning, power of judgment, power of decision making, memory, they may all be compromised. And this disease, as I said earlier, it happens more in old age. And old age is already having many other chronic diseases associated with it. They may have diabetes, they may have hypertension, as I said earlier. They may also have more likely of infections like COVID-19, for example, during last 1.5 years. But otherwise also they could have more things like urinary tract infection, gastrointestinal tract infection, chest infections, and so on. They are also liable to have all kinds of disabilities. They may have fracture, they may have arthritis, they may also have frailty. So I think while in old age a person may be grappling with many problems, and once over and above these problems, dementia also sets in, which has problem of understanding and problem of taking any right actions at right time. This all disturbs the treatment and care of other associated diseases which may also be present. I would give you an example about diabetes. Now, diabetes, it often requires a great self-care management. You have to take your medicines very regularly in order to keep your blood sugar control. You have to see that you take your meals at proper time. You have to see that you give insulin dose quite accurately and at proper time. Otherwise, it might cause hypoglycemia, that is lowering of blood sugar. So all these things are necessary for caring yourself. And if you are suffering from forgetfulness due to dementia, or you have other problems due to dementia, not understanding properly, what you are going to do, you would probably miss a meal, or you might have taken a meal, but you forget that you have taken a meal. You might ask for a meal again. You might have not taken the tablets. You might have forgotten to take insulin and your blood sugar shoots up, or you may have taken a wrong dose because you no longer recognize the insulin syringe and how much dose to be filled. So you have to take the help of your family caregivers all the time. So these are the problems. And in COVID-19, as you have already known, that lot of people who are in old age homes, particularly in Western countries, many of them died because of COVID-19, and it is said that many of them had dementia. So dementia might have prevented these people from observing the COVID-19 appropriate behavior. They do not know when to use the mask. They do not know when and how to wash hands. So all these things will create trouble. And this applies to all the other chronic morbidities which an elderly gentleman may be having along with the dementia. And one important thing I would like to say, particularly in relation to diabetes and urinary tract infection, that in the middle of the night, when he is trying to pass urine, sometimes many times in the night during sleep, and he's trying to look for the bathroom, he may lose his way. He may not be able to recognize the direction where the bathroom is situated, and he may fall in the process, and he may fracture himself. So these are all the nitty-gritties of difficulties which a dementia patient faces. That was your second question, but that was your third question. You had asked a second question. What was the second question in between? Do you remember? Yes.
To prevent dementia in old age?
Good. Yeah. I think the preventive measures are basically based upon all the risk factors that I mentioned. That means keep your diabetes controlled, keep your blood pressure under control. And in addition to that, you have to have a beautiful lifestyle. You eat well, exercise well, involved in physical activity, you sleep full, and don't smoke, because smoking and alcoholism is also a risk factor for dementia. And other than that, you have to make friends, you have to be socially interactive, don't try to be lonely. So all these things you can take the help for preventing mania. And above all, you have to keep your brain all the time stimulated. You have to continue doing all these activities by which your brain remains active, because brain is something that you use it or you lose it. And for example, if you are old enough and you are sitting in home, you can befriend your grandchildren, play with the grandchildren, play puzzles, and play cards, or sometimes you can play chess, which compels your brain to be active. Or if you are little educated and you are quite up to the present knowledge, you should use computer. I think exploring the internet is a very good brain exercise. And I would say that without depending on others, elder people should inculcate, as they age, they should inculcate the habit of paying the bills online, pay utility bills online. They may submit their property tax or income tax returns by themselves without depending on others. And they can even apply for driving license, for example, online, and all these. And they may, if they are having a hobby, they could they could imbibe a new language, learn a musical instrument, do the gardening. In the gardening is not just a hobby. You have to plan a garden. You have to say where to put the flower plots and pots. This all stimulates the brain. You can also have healthy humor with your friends and family members. So all these things will prevent you. So I think anybody who is heading towards the becoming senior citizen, and he is going to be relieved mostly from his professional duties, he should get involved in brain activities and continue to remain in brain active, and then he will be having a good cognitive power for quite many years to come. So these are the preventive strategies for preventing and controlling dementia. Thank you.
Thank you so much, Vinod sir, for a wonderful explanation that you gave it to us, sir. Meera ma'am, we have our next question for you, ma'am. Meera ma'am, am I audible to you?
Yes, you are.
Good morning. Good morning, ma'am.
Good morning.
Okay, ma'am. The question for you is, what is the level of awareness among people regarding brain health? What is the level of awareness among people regarding brain health?
Yeah, that is a great question, Asha ji. And I would like to, give my thanks to NIST for collaborating with ARTSI to have this panel to observe World Alzheimer's. So what exactly do we mean by brain health? Is there an echo? Are you hearing an echo?
Yes, ma'am.
Oh.
Do you have two gadgets on?
No, I don't have to. Okay. My phone was close by. Okay. So now, what do we mean by brain health? Yeah, I think I removed my phone and put it far away. In layman's terms, Brain health is the ability to perform. I think it's still here. Is it okay? Echoes pretty bad.
You can
Still an echo.
switch off the
Have you
phone.
connected to the WebEx from two devices?
No, I only came. I don't have the app, so I just joined as a guest.
You can switch off the phone if you want.
Okay. Yeah. Is it better?
Meera, do you have earphone? You want to try that?
Yeah, maybe.
Headphone.
Can you hear me now?
Now it's better.
Yes, ma'am.
Yeah, it's better. No echo?
No echo now.
Okay, perfect. Dementia, thanks for solving the problem. Okay, let me start again. So what exactly do we mean by brain health? So in layman's terms, actually it means the ability to perform all activities related to cognition. That is, the ability to learn, to judge, to use language, and to remember. Over some time, over age, these functions may become slower, and a lot of people will lose some of these abilities, and that is normal part of aging. But as Dr. Matthew said, when these functions are impaired to such an extent that the person is not able to continue with activities of daily living, then it definitely indicates a medical condition and that this person needs help. So dementia is a term that is used for this syndrome when persons exhibit characteristics of impairment of cognition. And, there may be many diseases, which I'm not getting into that. Unfortunately, right now, there is not that much awareness about dementia, though RC has been in this field for several years and we have been doing a lot of awareness work. This lack of awareness exists both amongst the general public as well as the medical and health professionals. For instance, take a simple thing like memory loss. Most persons will say that old age will bring in memory loss, which is quite true. But what about short-term memory loss? This is really confusing as families will wonder why the person can remember something which happened way back in the distant past, but cannot remember what that person had for breakfast that morning or that the son or neighbor visited them earlier that day. So, in fact, the common man will not even know the term short-term memory. Also, changes in behavior, whether it's aggression, depression, suspicion, these all could be indicators of dementia, symptoms, early symptoms. But the layman has no clue that these may be manifestations of a deeper problem because they're not aware of what are the early signs of dementia. And this lack of awareness amongst the general public, this again, I'm repeating a lot what Dr. Matthew has said. This is one of the main causes for low diagnosis. And that too, when the diagnosis happens is only when the behavioral problems set in. Added to this, there is a lot of stigma. And this is why another reason that people don't want to go see a doctor, because what will people think? So a lot has to be done to improve awareness and to eradicate stigma so that more cases are diagnosed. Also, knowledge amongst dementia among the medical professionals and community and healthcare workers is also low, and this is really worrisome. A lot of general practitioners may know about dementia, but since there is no cure, they will just tell the family that this is just part of old age, this is old age dementia and nothing can be done about it. Also, healthcare and community workers may not recognize the symptoms as they're not aware of the early warning signs. And so they will not be able to advise persons with dementia that, this is a deeper problem and this is where they have to seek help. What are the referrals they need to take? That's why this World Alzheimer's Month, the theme is No Dementia, No Alzheimer's. And the 10 warning signs of dementia are being published with a lot in different languages and in very nice infographics so that everybody can understand. So that's the level of awareness in the community today. But what we need is for depression, we had Deepika Padukone who came out and spoke about depression, and suddenly there was no longer any stigma attached to it. A whole lot of other celebrities all said, I have depression, come out and talk about it. So if we can get some eminent persons or, some celebrities who will come out and talk and say, okay, somebody in my family has dementia, then it will be really, to change the scenario, there'll be more awareness and there'll be less stigma. Thank you.
Thank you so much, Meera ma'am. Nilanjana ma'am. Good afternoon, ma'am.
Good afternoon, Asha.
Ma'am, we have few questions for you also. What are the barriers to improve the quality of life in a person with dementia? What are the key areas to improve the quality of life of a person with dementia? And what skills are important to develop during training of a caregiver for a person with dementia?
Thank you, Asha, for those questions. I think these are very important. Once the diagnosis has been done in a family, supporting the person who's living with dementia and the family members who are caring for those living with dementia is a long journey, lots of ups and downs. So if I focus on the barriers that we face as an organization, as society as a whole, or the family members, there are quite a few barriers when we try and improve the quality of life of the person. Number one being, I think our speakers have already addressed that, which is stigma and misconception. So stigma about dementia as a condition. The moment we hear the word dementia, it's a death sentence. So basically, once the diagnosis is done and the family members leave the doctor's office with that white piece of paper where it is mentioned, the type of dementia and these are the medications and basically a picture that nothing much can be done. This creates a lot of barrier to improving quality of life because right from the beginning, the family members accept it as an incurable. Yes, it is incurable. There's no way we can change the truth. But the fact that there is a lot that could be done is not in the picture when they leave the doctor's office. So that's one issue. The other is misconception, which is that dementia or the irreversible types is a mental illness, which it is not. It's a brain disorder. And these misconceptions and that, dementia is a normal part of aging, these kind of misconceptions creates a barrier, as a caregiver, when you try and improve the quality of life, these two are a huge barrier. Number two, which we find, as an organization, as a caregiver, as a professional caregiver myself, I feel that, I'm not a medical person. I am a caregiver, professional caregiver. So my focus is holistic care, right? I see the person with dementia first and then the disease later. But that's not how it is done. So every issue or every symptom and sign that a person with dementia goes through, it is put under a medical microscope. So, why is he not eating? Why is he not sleeping? Why is he not talking? Every symptom, every move is considered to be medical. And therefore, medicine is the only answer to, to manage those symptoms. But not necessarily that's, the first line of intervention, but that's how it is. So that's the second barrier we have. The other is, of course, there's lack of national policy, and hence, there isn't much resources out there to help with developing services and programs. And that includes training caregivers. And, dementia caregiving needs very careful and in-depth training for us, the family members as well as professionals, because this is a long journey. And as I mentioned, there's going to be up and down. And there are little, minute details, even within the family, their role, their relationship, all these matters when you are providing quality care. So that's a huge problem because of the lack of resources. And, because of the lack of resources, the untrained caregivers, they are the ones who are providing care. And if they are not knowledgeable, they will not be able to provide quality care. The other is, of course, due to the stigma, misconception, lack of training, the environment that is around the person with dementia is threatening. So every person who walks into the room of a person with dementia, it is already assumed that you are forgetting things, you are unable to do things. So my body language, the questions that I ask, it reflects that I'm kind of threatening to you. So people with dementia take back seat and keep quiet. They would rather keep quiet. And, I remember, an incident long back. This was in my early days in Kolkata when I was, doing the counseling part with the family members. So this one particular family wife, she calls me up and says, "Can you come and talk to my husband?" Her husband had dementia. And I said, "Yes, I will." So I visit the family, and I asked, as I arrive, I asked the wife, "So what's the issue here?" And she said that my husband is very upset with me. So I looked at him and I asked him, "So what's the matter, sir? Is anything there that I can help you with?" And he says, "Well, I'm not sure if you can. It concerns my wife. Since last week, the only question she asks me day and night is, what is my name? And who am I to you?" Now, I don't answer her because I don't think that's, a valid question from a wife of 45 years. That's a very, stupid question to me. Why would my wife ask what's her name? Do I not know? She has already assumed that I have dementia and I don't remember anything. I think it's better if you, find out whether she has dementia, because I think something here is wrong. So I think that environment that we create, so because his wife would always come near him and say, "Do you remember who I am? Do you know who I am? Do you know my name?" Now, this is an environment where it could be threatening as well as it could be something absolutely not meaningful to that person. So it's not always dementia that creates these threatening environments. So these are some of the barriers that I wanted to focus. I think my next question you asked was, what are the key areas we can focus on for improving the quality of life? Again, these are information that I want to share through my personal experience of caring for people out there in the community. We have done long surveys with people in their very early stages of dementia. And we asked them, what are a few things that you want from us as, caregivers or, just general people? And one thing they have all said is, we want people to come and sit with us and talk. So facilitating relationship is something that is missing in their environment. So we need to do that. They have said that the time when we needed everybody to come and sit with us and be there for us, that's when everybody's out. It's darkness around us. So I think this is one thing, key area that if we could do, we will see a lot of change in their quality of life. The second, thing that I wanted to focus on was providing a calm and safe living space, which sometimes is overlooked in a lot of family environment or in a residential or a facility. The third thing that I feel is a key area is, of course, respectful communication. When we talk to the person with dementia, whether it's giving them instruction or just sitting and just giving our thought, sharing our thought, I think the communication has to be respectful. So keeping in mind that the person has years of wisdom and years of experience behind them, you're not talking to a child. Even talking to a child, it has to be respectful. So why not here? The other thing that we have experienced over years is that we need to come up with a very structured routine for a person with dementia. Unfortunately, there isn't much structure in the routine that they live with in most environment. The routine, of course, that is maintained is giving the medication, giving them a bath, giving them food to eat, and making sure that they're resting. So it's more of maintaining their daily activities, daily activity living. The routine is around that, and the communication is also around, have you had your, let's have the breakfast, let's give you a bath. There isn't much outside this. So we need to come up with a structured routine, and that will include everything: daily activities, other social activities, and it has to be structured well. And I must add here that we also need to include the element of choices, giving them choices. We don't do that. We assume that we are the caretaker, we are the care provider right now, and since you cannot take a decision, we will choose on behalf of you. But I think we assume these things. If given a choice, they are able to choose sometimes very well, in fact, even better than us. So this is one thing. The other key area is, of course, I mentioned meaningful activities. We need to introduce these meaningful activities in their lives. Again, assumption is wrong. They are able to learn, relearn, and enjoy, through these meaningful activities. But it has to be done well. It has to be done in a manner that, will encourage them to participate. The last key area that I would like to focus on is positive responses to challenging behavior. So we heard about, the difficult or the challenging behaviors that we see in a person with dementia, from repetitiveness to hallucination, delusion, anger, agitation. These, I believe, there is always a reason behind why they are behaving in that manner. Though we say it's a result of dementia, I personally feel that there is a reason for every behavior. And how we respond, not react to these challenging behaviors, is the key to improving quality of life. For an example, just the other day, we had this lady at our daycare center. She was hallucinating. It was a rainy day, and she was standing in the balcony of the daycare, and she started, shouting that, these boys, young boys, they are out there drenched in the rain. They should go home. They're going to fall sick. And she looked really, really anxious and worried. Now, if I, as a caregiver, went out there and said, there is no one there, what you're seeing is wrong. Why don't you just come in? There is nothing there. That's a response. That's a negative response. If we have to positively respond to that behavior, we have to validate first her feelings, her reality. In her reality, she is seeing lots of young kids, having fun in the rain, but she's worried that they'll fall sick. So my response to that behavior would be, oh my, these young boys, that's the nature. We have done it too. When you were young, when I was young, I have done it too. So not to worry, I'm going to make sure they go home and they don't fall sick. So why don't we, come in and sit and have fun? So I think how we focus on these key areas will make sure whether we can improve their quality of life. Is there a third question you asked me, Asha?
Ma'am, what skills are important to develop during training of caregiver for a person with dementia?
Okay, so in terms of skills or training that we provide, it's a bit different for family caregivers. A set of skills that we try and develop within family caregivers, and then there is a set of skills that we try and develop or train the professional caregivers. Because it's two different set of people, mainly that the caregivers have a personal relationship with that person. So, of course, for both, knowledge is important of what dementia is, have a very clear knowledge, not too much, but clear knowledge of why the person is behaving and why the person is going through the problems that the person is going through. So I think that knowledge is important. Knowledge is power, and I think when caregivers have that knowledge and understand that, it's easier for them and appreciate the difficulties that the person is having. That's common for both the population of caregivers. The second thing is, of course, communication, and I think it's something effective communication, which is applicable to both. It doesn't happen in a day. Family members take a longer time to develop effective communication because they have been living with this person for 30, 40 years or more, and they have a particular style of communication, and it's difficult to change that. But the very basics, the essence of communication, effective communication, can be practiced and achieved. Body language, while we develop this skill of communication, body language is something we encourage the participants to learn. So how you stand, how your facial expressions are, how you are using your hands to explain. So and how far are you from the person, or are you very near the person? Because we all know that persons with dementia have a binocular vision. So where you are standing in front of the person, it will spell how effective you are with whatever you're trying to do. Being empathetic is something that we focus on. Being creative, because we have to make up stories, even though they are sometimes white lies. We have to come up with these creativity to make sure that we continue to provide quality of care. The other thing I focus on is, of course, the listening skills, and listening with your heart rather than with your ears. I think there's a huge difference, and this is something that we focus on. We also focus on developing sense of humor, because if you are not having that age, that little bit of humor in you, you will be facing circumstances throughout your day where if you are not humorous, you will not be able to accept the situation and continue in your task. The other thing I focus on is, of course, curiosity. I think you have to be like a detective. You have to focus on every movement, everything that happens around the person, where, how, when, what happened before, what happened after. That is how you will be able to solve problems. I think the other thing that professional caregivers lack, and also family caregivers lack, is self-confidence. Sometimes, they probably, because of the responsibilities, they kind of start losing their self-confidence. But I think that is something that they need to develop, and they have to be motivated enough to develop their self-confidence. And the last thing which I basically feel, having being into training for so many years, I feel one thing lacking among especially the professional caregivers is common sense. Using common sense to solve problems. And I think if this can be done, developing common sense, it's going to make a huge difference in how we provide quality of life. So that's all.
Thank you so much, Nilanjana ma'am, for answering our questions. Next question we have is for Dr. Vinod Kumar sir. Sir? Dr. Vinod sir?
Yes, I am here.
Yes, sir. Yes, sir. So do you think Progressive cognition impairment in persons also deprives them of spiritual intelligence, which otherwise may prove to be a cost effective way of coping and managing these persons.
Well, the quick answer is no. Uh, I think it is a misnomer that a person who is losing his comprehension and understanding is also losing his spiritual capacity. I think it is wrong and it is a misnomer, as I said. Uh, I think it's important for anyone to understand in what context we are talking of spiritually at this point of time. You see, spirituality is present in every human being. Everyone has a component of loving himself, loving the others, finding the meaning of life, and they feel pleasure in giving uh, donations or helping out others, showing empathy and compassion, forgiving nature, and all kinds of these things. So whether these things are missing as the cognition is deteriorating, and I say that it is not, and there are scientists who believe that even in the later stages of dementia, these people are spiritual. And why it is important to find out the role of spirituality? Because spirituality helps in more than one way. They are able to, they make the person able to cope with day-to-day challenges of life, number one. Number two, they are helpful in preventing the progression of dementia in dementia patients, but they are also helpful for normal old age people that they do not get affected by dementia if they keep to the spiritually at a high level. That is number two. And number three, a belief in spirituality, including the religion, is also contributory to the longevity of a person. Now, let us first talk of a person who is frankly demented. That means his cognitive pathways are not working properly at all. Now, what should we do? How we can help? I think there are environmental components of spirituality. He may be shown the way by the caregiver, by the family member. And I think one should know that everyone, howsoever cognitively he may be compromised, he has retention of all the five senses. Like, for example, vision, hearing, sense of touch, sense of smell, and sense of taste. So if he can see, let him be shown visual religious symbols which do not involve any cognitive pathway to understand. Let him be taken to watch the nature, a setting sun, or a spring, or a mountain, or a water body, and let him also see something which is pleasant to him, by which he feels happy, and touch. Now, touch him with affection. You may even hug him, depending on your relations to this person. So that is touch. Hearing the music. Music is also a good spiritual way for emotional disturbances as well as for cognition. Then smelling. Smelling the aroma of, let's say, incense, aromatic incense sticks, which we use in our household. That gives you a good feeling. And then taste. Well, give him very delicious food which he likes. So these are something you can help through these five senses. None of them involves a cognitive pathway. But there are non-cognitive, there are cognitive pathways which he cannot practice. For example, meditation or reading the sacred text or going for pilgrimages or observing himself vegetarianism or intermittent fasting. These are all involving the cognitive pathways, which they cannot do it when they are advanced stage. But I think people who are in early stage, mild cognitive impairment or early stage of dementia, and for that matter, even people who have no dementia, but they are just simply aging, they can do this meditation, relax themselves, and they can do all these cognitive pathway activities because that will foster the sense of forgiveness, the sense of hope, optimism, justice, inquisitiveness to learn and all those things. So they're all spiritual pathways. And of course, if the people are not demented at all, they can prevent dementia by doing all kinds of other meditation, transcendental meditation, vipassana, Zen, Tai Chi, Qigong, and so many things. So I think there is a good role. So when I was talking how to prevent dementia in the population or how to prevent the progression of dementia in already demented patients, to the lifestyle, we should add the spirituality also. That will be going to stand in a good stead. So that is my take on the last question. Thank you.
Thank you so much, Vinod sir. Meera ma'am.
Yes.
The next question is for you, ma'am.
Okay.
What is the impact of pandemic on persons with dementia and caregivers? And what is the role of civil society in providing support for persons with dementia?
Yeah. I think the question of pandemic is very relevant today, because that is something which this pandemic and the resultant lockdowns, that has upset all our lives. And most persons with dementia, because they are elderly, they fall in the vulnerable category, so they are really affected. Now it is becoming more or less clear to us that the virus is not going to disappear anytime soon, and it'll keep mutating, and eventually we will all have to live with this and carry on with our lives. So we must devise extra support measures for persons with dementia. Actually, the first case appeared, in January in Kerala, and by March we had about 500 cases compared to the number of cases we have now. But at that point, the government declared lockdown, and this caught all of us by unawares, but it impacted the lives of persons with dementia quite badly. RC runs daycare services and full-time care services, but we had to suspend the activities of our daycare because there was no transport, and all people had to stay in the confines of their homes. Many people, they had help, whether they are maids, cooks, or some of them have relatives who come in and take care, provide, help to the family to take care of persons with dementia. And suddenly these people could not come. So what happens? Take for the instance of an elderly couple staying alone. So it is either the husband or the wife who's the primary caregiver to the spouse. And now this maid and the help, they are not coming. So suddenly there's a huge strain on the caregiver because they had to take care of the normal housework, do the cooking, and then also do the caring. So this was a really huge, unexpected and difficult task for them to carry on. Then they also had difficulties in procuring medicines and essential things because most of the shops were closed. Some of them had children, who will come over and help them with caregiving, but these children also could not come because of lack of transport. Then what about cases when they were younger children and they had kids? So in this case, the children had to take care of their younger ones as well as do the caregiving for their parents. So all this became really a very difficult situation. And but after a little time, government had made relaxations, and they said, okay, healthcare professionals or support staff can take passes and can visit the families. So then this eased a little bit. Then the pandemic also, they had the problem of getting medical help. They could no longer see the doctor in person. They could not get the necessary tests done. And then when the caregiver fell sick, even that day, that caregiver could not get medical attention. Of course, after some time, we had online consultancy. This became more common, and doctors advised, okay, let you call me on the phone, and then we will talk. But some of the senior citizens did not know how to do this. And what about the vast majority of people who have no access to such, telemedicine and how to get advice online? So this problem of getting medical advice became very difficult. But one important factor here is that we do not have scientific data on the number of persons with dementia who got COVID. What are the casualties and what is the rate of recovery? We do not know how many persons deteriorated a lot more during the pandemic. We know from experience because, as caregivers, we have been talking to persons with the family members, and we know that, earlier They were attending the daycare and they were much better, but now staying at home and not having these regular activities which they had in the daycare, they have deteriorated a lot faster. Some of them even could not come back to attending the daycare. Also, the safety precautions that they had to take. For instance, it is wearing of masks or, social distancing and not meeting with close people. Nilanjana said, the distance that you have to keep, the hugs, these are all very important for persons with dementia. But during the pandemic, none of this was possible. We could know no hugs. And then relatives, the children, grandchildren could not come to see them. There was only just one study which happened in Chennai, which showed that the caregiver stress increased a lot because of the pandemic. So on the whole, persons with dementia and their family members were badly affected. And so now we need to develop some schemes so that these people are given preferential treatment. Later, of course, even vaccinations were allowed for these people in the full-time care centers. But a lot more needs to be done for them so that their lives become more comfortable. So your next question was about the role of civil society. Dementia, it's unlike other diseases. It does not affect only the person concerned. It affects the full family, especially the primary caregiver. That is why civil societies, or as in India we call them NGOs, we have a huge role to play in empowering both persons with dementia as also caregivers, because our association, the Alzheimer's and Related Disorders Society of India, is also focused on helping caregivers or families. So let me give you a small peek into the World Alzheimer's report that is being published tomorrow by ADI. It says 90% of the cases do not get a diagnosis in lower and middle income countries. So the focus on getting a timely and right diagnosis is very important. And for this, NGOs have a big role to play. We need to educate and we need to spread knowledge, both amongst the general public. Importance has to be given to publicizing the 10 warning signs. This is being done very much during this World Alzheimer's Month. Infographics in various languages. And this is very easy to look at and to understand. Lack of awareness is the main reason for low and diagnosis. So by just spreading the word, people will recognize these symptoms, and these are not normal aging issues, and they need to get medical advice. Early and timely diagnosis not only helps the person with dementia, as Dr. Matthew said, to slow down the progression of the disease, it will also help to plan the care program, make a suitable will, meet the legal requirements, whether it is for the bank account, pension, insurance, and so on. Then what about providing guidance and counseling for caregivers, as well as training for both professional and family caregivers? Nilanjana spoke at length about this. ARTSI is doing a lot of training. In fact, Nilanjana is heading our training unit, where we are doing training both for family caregivers and professional caregivers. This is called the Dementia Care Skills Training Program. So NGO has a big role in providing the training. And this is necessary so that the quality of care that is provided by both the professional and family caregivers is good. And then, the caregivers are aware of what are the various symptoms, what are the care strategies for the various symptoms, and for the various stages of the disease. As it progresses, the care will also be different. So how do we go about it? Then comes providing of care services, whether it is daycare or residential care. Even that, the civil society has a good role to play. We at ARTSI are running, our chapters are running daycare services and full-time care services. But to meet the requirements of the entire, over 5 million persons with dementia in our country, this will have to be supplemented by state-run dementia centers. We in India, we have a large workforce because of our population. So what works best for us is to have people living in their homes with either the family caregivers or paid caregivers, and who are trained. Community workers also have a good role to play, because They are the persons who visit homes, especially in the rural areas and in the districts. And if they are trained, they can identify cases with dementia and they can tell the families where they need to help. They need to go and see a doctor. So this way, civil society can work in collaboration with government agencies to provide the training. I know NISD is having RRTCs, and then you have good training programs. So dementia care modules can also be included. We can also have small courses exclusively for dementia specific to train caregivers. And finally, civil society has a big role to play, being the voice of persons with dementia. And so we advocate for their rights. We are advocating with the governments, both at the center and the state, for exclusive programs, schemes, policies to meet their requirements. We need more diagnostic centers. We need more training for caregivers. We need more specialized geriatric workforce. We need setting up of care facilities. So on the whole, we need a lot of support from the government. So when it comes to civil society, whether it is ADI at the global level or societies like us at the country level, we all have a big role to play, both in providing services and improving the lives of persons with dementia and the caregivers, but also in advocating with the government and asking for more services and for empowering them and for making their life more easy. That's it.
Thank you so much, Meera ma'am. Our next question is for Dr. Matthew Varghese, sir. Sir, are you there?
Hello, can you hear me?
Yes, sir. Yes, sir. Sir, we are aware that ARDSI has presented a dementia report to the government. Can you please highlight the areas addressed in the report, sir? Matthew, sir. Matthew, sir, am I audible to you?
Can you hear me now?
Yes, sir. We are able to hear you, sir.
I lost my connection because of bad issue. So, what was the question to me? I didn't hear that.
Sir, we are aware that ARDSI has presented a dementia report to the government. Can you please?
Okay. Yeah. Okay. I got the question. Yeah. So, the Dementia India report was prepared by the RC in 2010, and this document is actually being used in a big way in the last 10 years to advocate for care of persons with dementia, to see that the country does things in the policy and programs to have provisions for people for dementia. We also came out with a dementia strategy report that was presented to the government, to the health minister in 2018 at the RC conference in Bangalore. So that is a Dementia India strategy as to what India should do in terms of taking care of persons with dementia. We also have a more recent and more later version of the Dementia India report from 2020 that is published at a conference at the RC conference in Cochin. And all these three documents are available online. You just type in Dementia India report or Dementia India strategy, you get these documents in PDF downloadable online. But what I want to mention about the Dementia India report 2010 is that it gave projections for the country for the next 30 to 50 years. So when we said that there was about 3.7 million people with dementia in 2010, we said that number would double in 20 years by 2030. But at this point of time, in 2020 or 21, it's estimated that there would be about over 5 million people with dementia in our country itself. And as all of us know, India and China have the largest population of older persons. And so India and China will indeed have the world's largest population of persons with dementia. Now, though we have about 5 million now, which is going to double, at the end of another 20 years, what is important to know is that the family is our main source of caregiving in our country. Informal, formal caregivers are really few and far between. And depending on our family's resources, we try and see that we are able to take care of the person with dementia. So families are the main resource, and we all need to empower the family, help the family, have training programs for families. And from the side of the government and the ministry, we need to see that the family has some respite. So having daycare centers, having mobile clinics, having dementia care centers, having long-term facilities, these are all very important in terms of providing for persons with dementia. Now, the cause of dementia is another thing that has been talked about. And we all know that the cause of dementia are both not just medical, but they're also direct and indirect. For example, the cost that we bear in giving up our work because we're caring for somebody, or the cost that we incur, in having somebody else lose a job, and so on. So if you calculate all these costs are actually going to double or triple every 20 years. So the cost is something that very few people are really looking at. And I think it's something that, economically, it is a huge cost for the family and the government and the state to look after a person with dementia. So we need to be prepared, and we need to make a plan, a clear dementia strategy for India, to see that we are able to handle this huge public health problem that is dementia. Thank you.
Thank you so much, Matthew, sir. Thank you so much to our resource person for the wonderful knowledge on this dementia care and management. If any participant has any question related to the session, so they can unmute their mic and ask to our resource persons.
Good afternoon. My name is Jaita, and I have a question for Dr. Matthew. I just wanted to know about the screening process. How long will it take, and how many days, or how many hours, so that families can be aware that this is how the screening process is to happen, and they can be prepared for it.
To suspect whether your loved one, your family member has dementia, it is a fairly simple process. There are screening tools available online. So you can go there and answer a few questions, maybe 4 or 5 questions. For example, if your older person has got a memory problem, he's not able to do many of the activities in his house, say daily activities like making cooking, or going to the bank, or going out and purchasing things, or managing his own affairs, then, or he has some behavioral problems, and he keeps repeating questions, and the 10 warning signs that Meera referred to, or 20 warning signs that Meera referred to, are things that you can look at. Now, this will give a suspicion of dementia. You suspect that your older person, your mother or your father or your relative, might be having dementia. Then the next step, when you suspect dementia, is to take the person to a geriatrician, a psychiatrist, or a neurologist, to a dementia clinic or a memory clinic. And there they will do a small bunch of tests, which might take just about an hour or two. And that history and those tests are enough to diagnose dementia. You might need to do some blood tests, and you might need to do maybe a CT scan or an MRI scan to to see which kind of dementia you might be having. But remember that the major type of dementia that is there, that is prevalent, about 70% of all dementias are actually Alzheimer's disease. And that's the reason why we give so much focus to Alzheimer's disease. So it is fairly easy and simple to diagnose dementia and to treat dementia. So once the dementia is diagnosed, the clinician will try and see what stage the person comes in. Is it mild stage, is it moderate stage, or is it severe stage? And depending on the stage, if it's mild, there are certain medicines. If there are moderate, there are certain medicines. And in severe, you may not be able to do anything with medicines. But more important than medicines is that we can teach the family to care for the person with dementia. So caregiver training and support, something that is very important for which the clinician with the health professional can impart to the family members.
Yeah, so initial stages, online you suggested, so the online questionnaires that we find, so that is enough initially to assess whether, there is a risk of dementia or not, and can eliminate the risk at that stage. So that's, before going to a geriatrician or a clinic or something, right? So those
So to put it
questionnaires.
very simply, if the older person has memory problems, and if the memory problems interferes with daily activities of living, then you must suspect dementia. You don't even need a questionnaire. Just these 2 or 3 questions are enough for a suspicion. If a person has got memory issues, especially recent memory, what happened yesterday, what happened last week, and if the person has difficulty doing activities of daily living, for example, cooking or going to the shop or managing bank affairs, then there is a very, very high suspicion that the person has got dementia.
Okay, thank you very much.
Hello, sir. This is Roshni. I have a question. Hello.
Go ahead, we can
Am
hear
I
you.
audible? Yeah. Sir, my question is that the people in rural area might be families. So see here what happens, sir. Geriatric wards also not available on the primary level, because in every district there is a geriatric ward, but in the primary health care centers in the rural area, there are a lot of issue to get medicine for the dementia patient. Actually, people here in rural area, they actually don't know what is mean by dementia and what are the symptoms of the dementia. So in that case, as a on the initial stage, or we can say as a family caregiver, what things we need to take care about that person who is having dementia, because if he got suspected by dementia, and we know that, and on primary stage, if the person is financially not able to get the treatment done, so in that case, like as a family caregiver, what precaution we should take, or what means like care we should give that particular person who's having dementia.
Yeah, I don't know if the question is addressed to me, but I will answer initially, and then the other panelists can take it up. Now, you don't need a dementia ward, you don't need a geriatric ward, you don't need any of those kind of facilities. To diagnose dementia, once you have a suspicion, you just need to go to a doctor, a geriatrician. Those may be hard to get, but a psychiatrist or a neurologist is easier to find. Just need to go to the doctor who is sitting in any hospital, any medical college, and most medical colleges and most hospitals, whether private or public, will have a neurologist or a psychiatrist. So you just need to go to that person and get the person to be diagnosed. Now, there is a program called the National Program for Healthcare of the Elderly, and this program envisages that you will have memory clinics and geriatric care specialists in every district and every taluk in the country. Now, the program was launched in 2011 or 2012, and slowly the program is picking up, and there are more and more doctors and counselors and nurses who are being trained and put in peripheral areas, district areas, and taluk level areas. And some of these medicines which are useful for people with dementia are also available in the public health system. For example, some of the antidepressants, the antipsychotics, and in some places, even the medicines to help with dementia for the cholinesterase inhibitors, they are actually available in the public health system. Now, as I mentioned, medicine is not the main thing. One of the things that Nilanjana mentioned, which I want to highlight, is that if you have a person with dementia in your house, you must have proper daily activity schedule. So there must be somebody who goes along with the person with dementia and helps him to do all the activities that he needs to do during the day. It is important to keep him stimulated. It is important to get him to do all the things that he can do as much as possible. So just because bathing takes a long time, the caregiver should not just start bathing the person, but you must do, as Nilanjana mentioned, person-centered care, and you must assist the person in bathing, as an example. So it
Okay.
might take some time, but when it reaches moderate stage and the person cannot bathe for himself or herself, you need to prompt the person and help the person to bathe. Similarly, you have activities in the day which might be exercise, for example, going for a walk for half an hour in the morning and the evening. It might be, some recreational activities, some playing some very simple games with him or her. It might be looking at photographs, listening to some music, reading from a book or a magazine. These are things that you can do. And caregiver programs, I know that in rural areas, the awareness is low and the programs are not there. And people in the rural areas, their main priority is getting money and finance and having a job to feed the mouths that are
Yes,
there
sir.
in the house. I know that is a big
Exactly.
issue. But there
Yes,
are
sir.
there are programs, and slowly, with the National Program of Healthcare of the Elderly, slowly we will have people who are counselors, doctors, and nurses who are geriatric care specialists in every district and every taluk in the country. I don't know
Yes,
whether
sir.
that answers your question and whether the other panelists have anything else to add.
Yeah, may I
No,
add
no,
something?
actually, sir, yeah,
Well,
I'm
yeah,
quite satisfied with your answer. I was just asking about the rural areas because, as you said, that yeah, people are seeking for the money, especially after during this pandemic. They do not have like means provide attention to their own self, their own health. So if they're having a person with dementia in their house, it would be quite difficult for them to take care of that person. And especially for the actually they don't know, even they are not aware about all this facility which government is providing, which is geriatric ward by the government system itself. So it is a big challenge in the rural area to keep that person aware, must keep people aware about dementia kind of diseases.
well, as
Yeah.
it
Thank
said,
you, sir.
yeah. I may I add one or two small points. I
Yes, sir.
think this national program for the healthcare of the elderly, although it is 10-year-old, but it is taking time, but it is definitely spreading all over the country. And there are 2 points I would like to make in relation to dementia. So the multipurpose health workers who are the uh, health providers of the first contact, they are undergoing training, and according to a schedule of uh, the manual, which is already prepared, which is for overall detection and advising as the person of the first contact on all aging issues, including dementia. That is number one. Number two, if the patient has been diagnosed dementia and he is still in a village setting, for him, there
Yes.
is a cadre of people called rehabilitation workers who are present in every taluka hospital, and they are supposed to make the visit to that place in the village for rehabilitation of any disability, including dementia. So I think this is slowly moving up, and with all this big population that our country is facing, sooner or later these things will, and I think simultaneously the mass awareness is also being created. So I think something is going on, although it takes time because of the vast population. Thank you.
Yes, sir. Thank you very much, sir. Thank you.
Sir, there is
this is being recorded. The program is being recorded.
Yes, sir, it is being recorded.
Will it be available to people later on also?
Yes, sir. Yes, sir. It will be available, sir. It will
On
be available.
YouTube? On
Sir,
YouTube?
on YouTube and Facebook page of NIST, sir.
Okay. Okay.
So there is a question from Madam Supriya Chakravarti in the chat box to the panelists. My question is in net. Where can I get some relevant questionnaire to do memory test, as Dr. Matthew mentioned now? My audio is disturbed, hence sending my question through a chat. Please attend this question. Sir, you are not audible to us, sir.
Can Dr. Matthew, would you like to answer, or?
I cannot see the question. What is the question?
The question is there any readily available questionnaire for testing the memory?
For testing the memory.
Yes.
You don't really need a...
Sir, you are not audible.
Well, I can partly answer this question. Can I?
Yes, sir. Kindly go ahead, sir.
Okay. Okay, there are simple tests for screening for dementia. And some of these tests can be done by the family members themselves. Of course, MMSE is a 30-item, rather long questionnaire, which I would not recommend for anybody in the field from the family. But there is a test called clock drawing test or mini clock test, which just takes about 3-4 minutes, and the person suspected to be suffering from memory disorder is asked to name 3 objects, and then as a detractor, he is asked to draw the face of a clock and put the hands of the clock for a prescribed time. And then he's again asked after that, what are the 3 objects that he was shown earlier, maybe 2 minutes before? And it depends how correctly he answers. Does he recall all the 3 objects? Does he recall 1 object or 2 objects or all the 3? Or he's not able to recall any of the 3 objects? And whether he drew the clock and put the hands of the clock, giving the right time that was asked for. And that is simple test which can lead someone to say that this patient is scoring either as normal or borderline or cognitively deficient. So this is something can be done. So this is available. You can just Google it out and then you can find out. It's called MiniCog, MINICOG. It's also called clock drawing test in a modified form. Thank you.
Thank you so much, Vinod sir, for answering the question. If any participant has any question, they can unmute their mic and can ask our resource person. So Supriya madam sent a thanks a lot to you, sir.
Again, Supriya here. This is, I don't know who can answer this. I have noticed when I'm from Calcutta, good day to you all. And when I go for the, attending the dementia persons, their family are agitated. Not only that, but these persons, even those are not that much affected by dementia, the aged person are very rigid to learn any new things or even to listen and I shouldn't say obey, but to listen and carry those works. My question is how to involve those senior group in the brain activity. Anybody can answer me. I will be very happy to hear from you all. Thank you.
I think, ma'am, everyone has understood the session and So I think, ma'am, we can go ahead with
Yeah.
wind up the session, ma'am.
Are you able to hear me? Yes?
Yes, sir.
Okay.
Yes, sir.
So if you talk to different people after many years, maybe they were your friends, but you find a bag of mixed responses. Some people are very enthusiastic. They immediately recognize you. And even if they don't recognize you, they talk and they're in full senses. They're enthusiastic. But there are others who have gone down with mental slowness. Their spouses are saying that he feels lonely, he feels depressed, he is not able to remember anything, he is not able to recognize you. So this is a mixed bag of people. And why this is mixed bag? Of course, nature has to do something. But I think your question, Supriya, is very relevant. How to prevent this downslide of cognitive and memory problem? And I think it is a work of a lifetime, particularly when you have passed middle age. And you have to keep whipping your brain, challenge your brain by a variety of methods. I have already named some of these methods. I will not repeat it. But I think a person has to prepare himself for a old age when he is past 45, 50 or 55, when he's going to quit the job. And if he continues to stimulate his brain by all the activities that I have named earlier, I think this problem will be mitigated to a large extent. Thank you.
Any other question? Any participant have?
I have a question for Nilanjana ma'am. Because she just said that there are different type of like things where we can take care of people who is having dementia. So in that case, the question is very. I would like to hear from you like, what prevention should be taken because we are getting now and somewhere she is slowing down her activities, her moves. So what prevention should be or like precautions should be taken in that case to prevent dementia on the certain age?
Yeah, these
My
are all.
question for, yeah, I
Yeah,
think Dr. Vinod Kumar already addressed the preventive measures, at length. Um, so, would you like to repeat once more, Dr. Kumar? Just,
I'm sorry to
the
bother you again, ma'am, but I would really like to hear that because I missed a session just before because I was doing some like my work from home activity. So that's why I'm really very sorry to bother you all.
no
But it is
problem,
very
no
important.
problem.
No problem, no problem.
Roshni ma'am, this session will be available on the Facebook page also after a few hours, like maybe in an hour's time or 2 hours time. It will be available on YouTube and Facebook channel of NIST also. From there also you can hear ma'am's session. But yes,
Okay,
ma'am
okay.
can go ahead.
Thank you very much.
Neelanjana ma'am, if you can briefly answer Roshni ma'am.
I thought Dr. Kumar was going to do that. He is an expert in that.
Yeah, yeah.
I take care. Once they
Okay.
come, I take care. He's the one who does the prevention.
Okay. All right. Well, I'm glad to repeat, although very briefly now. I think anyone who wants to see that he doesn't slip into dementia in old age, he should start preparing himself, as I said earlier, from the middle age onwards, if not from the young age. And the golden principles are eat right, exercise well, sleep full, re- re- avoid smoking and avoid stress. And these are the things that will prevent. And of course, the brain challenging activities I have dealt in detail, which will also prevent from cognitive decline, which is accompanying anyway persons who are aging. But let us try that this cognitive decline, which is age related, should not slip into the syndrome of dementia. And as you will see the Facebook page, all these have been mentioned in greater detail. Thank you so much.
Thank you, sir. Thank you very
I
much.
think whatever you do for your heart, you do for your brain. And you add, like Dr. Kumar mentioned, you add mental stimulation, other than what you do for your heart, right? You exercise well, you eat well. And then the two other things that he mentioned, which are very important, is mental stimulation and social interaction. These two things are very, very important to bring into your life. I think, eating right and exercising well, we all know, but we don't do it. Yeah, two other things. Mental stimulation is also something that needs to be practiced. And mental stimulation, where he mentioned, it's the focus on learning something new every day. I think that's the essence of your stimulation, and not doing the same thing over and over again, but learning something new every day. So that's the prevention strategies for you. You can start right from today.
Yes, ma'am. Thank you very much. Actually, we are attending the session. That's why we are getting to know all these things. But I'm worried about my earlier generation, like my mother-in-law, sorry, my mother at the same time, my grandmother. Actually, they are really not ready to do all these things because they have their own mentality that if we are doing this, we are going to this only. We are not going to change our habits. We are not going to, if we are explaining them, still it is they have a different mentality. So for that, as what we can do, this is the major issue over here. It's like people have like fixed mentality here in rural areas. It's very difficult to make them understand things.
But I can tell you that all the time when you are spending your life from the young to middle age, you think your body is very important. But when you are old, like me, then you start finding out that the more important thing is your mind, not the body. Because you cannot look after your body if your mind is not working. And I think those of us who have been, by virtue of any circumstances, were involved in severe physical activity throughout our life, or we didn't have much to eat, like what our children have a lot of things to eat these days. We were blessed at that time, and that is what it takes one to a good mind, even in old age. So I think people have to learn about it, and I think the time is not very far when people will start doing it. So forget about our present grandmother and grandfather who didn't have that kind of a training and awareness, but now the training and awareness is going on. Thank you so much.
Yes, sir. Thank you very much for your valuable information, sir. Thank you, ma'am.
This is Satya Babu from HelpAge India. Actually, I have two questions. Number one, for which is the best place for Alzheimer's people to care? Number one is family or community or institutional care. Number one. Number two, is there any program implemented for the Alzheimer's on community based? Here in Tamil Nadu, palliative care, there are special nurses in the government hospital and the PHS. But these people, they are taking care of bedridden. Like this, is there any special community-based program which is available or experimented for the Alzheimer patient? Thank you.
Shall I answer that, Meera?
Yeah.
So Dr. Kumar is the right.
The best best people to take care of a person with dementia is the family, the family, the family. Not a home, not a hospital, not anywhere else. And the second question, there are various community programs which are run by the RC. Possibly Meera can talk about it. Many RC centers in Mumbai, in Cochin, in Chennai, unfortunately, these are in the big cities. But there are caregiver programs that are run. Maybe Meera can highlight that.
Yeah, I totally agree with you, Matthew. The best.
Is it home care based, or sending some nurse to the home, or training the family caregiver likewise, sir? So I'm sorry. Or otherwise, if there is any, I mean, the process documentation report or something, I can get it from IGV.
We recommend home care. You can get the help of some person who you can very simply train to look after a person with dementia. So to reduce the job of the caregivers at home. You might get somebody together with you. You don't need a nurse. They might just be at the level of an A&M or so. You need somebody to accompany the person with dementia and see that the person does not get into any trouble and the person is helped. That's the cheapest and the best.
Thank you very much.
Putting the person in a home is expensive.
Yeah, I totally agree with Matthew that, can you hear me?
Yes, Meera, loud and clear.
Yeah. So, but you don't need a nurse or anybody special. We have so many persons in India who their maids take care of the caring. But our organizations like us provide care. We can tell you can send those persons for training programs. We are doing now. We have started even online training programs, both for professional caregivers and family caregivers, so they can enroll in this online training program that we are conducting. So they'll be better qualified to take care of the persons in their homes. As regards what services are being run, ARTSI has a presence only in 22 states, cities. And so there we are taking care of persons in our care services. But the only state where the government itself is running a daycare or a residential care is Kerala, because they have the Kerala State Initiative on Dementia. So this is an ideal model. We have been advocating with other states also to start similar programs in the states. But the states will set up, this will be totally free centers for daycare and residential care, because it will not be possible for an NGO like us to provide this sort of service throughout India. But once the state government step in, we'll be able to provide a lot more services where persons with dementia will be given professional care in these centers. But as Dr. Matthew said, the best care for a country like India is definitely home care.
Just to mention what Meera said, and maybe Asha Madam might want to mention it, the NISD itself gives money for small projects where you can train caregivers of people with dementia. I know that ARTSI Bangalore and many other ARTSI centers have used the finances from NISD. Maybe Asha Madam wants to mention this.
Sir, yes, we are running the courses here, 3 months like geriatric caregiving course, and we do a sensitization like program for the awareness about dementia. And on Tapas, an online platform, learning management platform, we have two modules, like 2 courses, and which one is for the care and care of the elderly person, and the another is for dementia care patient. Like it is a free online courses which are available, and like how to maintain the hygiene, nutritional status for the dementia patient, safety for dementia patients. So those who are interested, they can also register themselves and can go ahead with watching the videos, and certificate will be awarded after completing all the formalities also. So this is how we are doing, sir.
I think there are no more questions now.
Research के लिए कुछ fund दे- Ma'am, can we go ahead with binding up the session?
Yes, please.
Thank you so much to all our resource persons, Dr. Matthew Varghese, Dr. Vinod Kumar sir, Meera ma'am, Neelanjana ma'am, for giving their valuable time on behalf of National Institute of Social Defense, Senior Citizen Division. I would like to extend my gratitude to all the dear resource persons who took the time from their busy schedule and took a webinar positive information that all of you have shared with us, sir and ma'am. And we are also thankful to all the dear participants who has joined us today and had listened the complete session, and they have so many questions that they came and asked to all our resource persons also. So we are very thankful to everyone who came over here on this platform and interaction with us. Thank you so much to make this a success. Thank you so much to everyone.
Thank you very much. Thank you.
you.
Yeah, thank
Thank
you.
you.
Thank you very
Thank
much,
you,
NISD.
Thanks.
Thank you, Meera, Nilanjana, and Dr. Vinod.
Yeah.
Yeah.
Thank you.
Thanks
Thank
to
you
all of you. Thank you.
Dr. Vinod is the best example of aging gracefully.
True. A lot to learn from him.
Yeah.
It's you people who keep me going.
Yes. That's for sure. Thank you. Thank you so much.
Thanks,
Always
Take
everyone.
care.
interact with all
Thank
of
you.
Thank you.
Thanks.
Bye-bye.
Bye.